Hello everyone, I am James Andres here, Corbel from BSN 111I, a student nurse from Davao Doctors College. And in this video, I'll be performing my return demonstration in parenteral drug administration and using intradermal, subcutaneous, and intramuscular injections. This demonstration is a medication that goes to our body by injection through the tissue and circulatory system. Now for the intradermal infection or injection, first thing first is check the physician's order or the patient chart. This is to ensure that the medication of the client, and after that, greet the client politely, introduce self, verify client's identity using two identifiers, which is the name and the birth date, ask the client how to be called during the assessment, and don't forget to establish rapport. Also explain the procedure to the client and how he or she going to perform the procedure. And lastly, don't forget to perform hand hygiene to deter the spread of microorganisms. Next is arranging the medication jug on the hypodemic tray with the corresponding jug. The side materials are syringes. I have here a tuberculin syringe for skin test. Next is the insulin for the subcutaneous. And lastly, the gauze syringe for the intramuscular. And next is the sterile water, a cotton, a med tray, a trash can, and a clean gloves to reduce the risk of the exposure to the blood. After that, I am going to prepare the syringe for the intradermal. With that, I have here a tuberculin syringe. Now I am going to open the package. Always remember that we can only touch the barrel and the plunger of the syringe. Now I am going to open the vial and then clean the opening area with the use of cotton and alcohol. After that, I am going to get my syringe and uncap. And then I am going to draw an air into the syringe. Then now I am going to push the air into the vial. Pushing air to the vial prevents vacuum from forming. So now I am going to invert the syringe with the exact amount of medication. After that, if you see bubbles in the syringe, then slightly top the barrel. Now I am going to insert the aspiring needle. Make sure that the connection isn't loose. Now I am done inserting the aspiring needle. So now I am going to write the medication ticket, so we won't forget what medication it is, the dosage, and of course for whom it is. Hello, sir. Good day. I am Jan, sir, student nurse for today. Before anything else, sir, can you please tell me your name, please? Okay, your birth date. Okay, thank you. By the way, sir, what do you want me to call you? Okay, Mr. Poo. For today, Mr. Poo, the procedure that I will be doing is intradermal injection. This is to know if you have any allergies. And this procedure, sir, may hurt a little bit, but please, sir, while I am injecting, don't move your hand, okay? Okay, sir, thank you. Before you proceed, sir, do you have any questions or clarifications? Okay, thank you. So, for a while, sir, I'll be back. Now, choose an injection site that is free from lesions, discoloration, below from the antecubital space, and one hand above the wrist. The position of the patient's arm so that the elbow and forearm are supported in the flat surface. Apply clean gloves, then use antiseptic swab to clean the site beginning at the center in circular motion outward about 2 inches to 5 centimeter. Now remove the cup and hold the syringe between the thumb and forefinger of your dominant hand and with the level of needle pointing up. Stretch the skin taut and at the injection site by pulling gently with the thumb and forefinger of your non-dominant hand. Pull the needle very close to the patient's skin. Insert slowly at 5 to 15 degree angle until you feel the resistance. Advance the needle up to the epidermis about 1/8 inches or 3 mm. Slowly inject the medication and feel the resistance until you see a blob that resembles a mosquito bite will appear on the patient's skin. Withdraw the needle at the same angle that it was inserted and pat dry a cotton ball. And always remember, do not forget that do not massage the said area. Encircle the wheel with blue or black ball pen and instruct the patient to do not rub the wheel or erase the mark. Assess the patient to a comfortable position, indicate the site and due time for reading. Don't recap, use needle, discard the needle and syringe to appropriate receptacle. Wash hands and document the procedure. Interpret the results after 30 minutes. Hello once again, sir. How's your hand? Now may I see your hand, sir? And as I observe, sir, there is no redness, so it means you don't have any allergies. Okay, sir, thank you. Hello, sir. Good day. I am James Andre, your student nurse for today. And for today, sir, since you cannot take the drug orally, we are going to take the medication via subcutaneous injection. Okay, sir? But before anything else, sir, can you please tell me your name, please? Your age and birth date. Okay, thank you. And before you proceed, sir, do you have any question or clarifications? Okay. This procedure, sir, may hurt a little bit, but please, sir, while I am injecting, please don't move your hand, okay? Okay, sir. Thank you, sir, and I'll be right back. So now we will determine which site. Shift the patient's bed linens, expose the only potential injection site, inspect the area for bruising, inflammation, and edema. Palpate the site and avoid any area that is tender to make sure you have the right needle. Also, use your thumb and forefinger to grasp the skin fold and tissue at the injection site. And Measure the fold from top to the bottom and check the ensures that the needle is about half as long. Place the patient in a comfortable position. Ask the patient to relax the area you're about to inject. Apply clean gloves. Clean the site with an antiseptic swab in a circular motion starting from center to outward. Remove the needle cap by pulling straight off. Hold the syringe between the thumb and forefinger of your dominant hand as you're holding a dart. Insert the needle quickly and firmly at 45 to 90-degree angle. Release the pinch the skin. Rest your non-dominant hand on the patient. Move your dominant hand at the end of the plunger and slowly inject the medication over several seconds. Retain your grasp on the syringe to keep it still. Quickly withdraw the needle, place the swab on the site and apply a gentle pressure but don't massage. Now remove the gloves and throw the syringe that you use and perform hand hygiene to deter the spread of microorganisms. And also, place the patient in a comfortable position. Record the documentation with the time and exact amount of medication given. Hello sir, good day. I am Jans, your student nurse for today. And for today sir, we will proceed the intramuscular injection because this allows the medication to absorb quickly to your bloodstream, okay? And this procedure sir may hurt a little bit, but please sir, while I am injecting, please don't move your hand, okay? So before sir, can you please tell me your name? Your birth date please? Okay, thank you, sir. And before you proceed, sir, do you have any questions or clarifications? Okay, thank you for that, sir. And I'll be back. Select an appropriate site for the injection. Vastus lateralis and deltoid muscle are possible for the eye injection. Examine the integrity and amount of patient's muscle mass and palpate the muscle area for tenderness are not suitable for injection site. Inspect the area for bruising, inflammation, and edema. If skin shows bruises or inflammation, use the other side. And help the patient find a comfortable position that will accommodate the injection site you've chosen. Expose the only portion of your body. Apply clean gloves and use anatomical landmarks to find the site again. Disinfect the injection site in a circular pattern from inner to outer, about 2 inches. Hold the gauge pad between the third and fourth fingers of your non-dominant hand. Remove the needle cap by pulling straight off. Hold the syringe with the thumb and forefinger of your dominant hand as you're holding a dart. Place your ulnar side of your non-dominant hand and just below the injection site and pull the patient's skin laterally about 1 to 1.5 inches. Hold the position until you inserted the needle. Continuing to pull the skin taut of your non-dominant hand. Aspirate the syringe by pulling back the plunger with your dominant hand. If blood appears, find another site. If no blood appears, proceed. Since there is no blood, let us now proceed. Release the skin and place a cotton pad on the site. Apply gently pressure but don't massage the area. Now throw the syringe that you use. Remove the gloves. And perform hand hygiene to deter the spread of microorganisms. And lastly, place the patient in a comfortable position and document the procedure. And that's it for the parenteral drug administration in intradermal, subcutaneous, and intramuscular.